Welcome. Today we are going to talk about a childhood mental disorder called attention deficit hyperactivity disorder. Attention deficit hyperactivity disorder is a developmental disorder where a child presents with inattention and distractibility with or without hyperactivity. The onset of this disorder is usually not later than 12 years, and the above symptoms should be present in two or more situations. The inattention or hyperactivity should be present in at least two situations, either at school and at home or at work. So, what are these symptoms? So, the symptoms of inattention include the following: failure to pay attention. The child will be in class and the teacher is explaining something, they are not able to pay attention. They make careless mistakes in schoolwork or other activities that you may not usually expect them to do. They have a problem with sustaining attention during play or work activities. So, ideally, when a child is in class or is playing, sometimes they have to pay attention and follow a certain trend of play. But these children with attention deficit hyperactivity disorder are unable to actually pay attention. They never tend to listen to what is being talked about or said, and they cannot follow through instructions because they are not listening. They usually dislike tasks, especially schoolwork and homework. You find a child, they will always find a reason not to actually do the homework. So any activity that requires sustained mental effort is a problem to them. They often lose necessary things for especially like tasks for schools. You find they lose the pencils, they lose books, they lose tools or toys. You find a child, most of the time they go to school, they never come back with a book, they never come back with the pens. And when they're playing with toys, usually they lose them. They're often distracted by external stimuli. They're in a situation and if they hear noise out, they're distracted immediately. They are quite forgetful in daily activities that they are doing. And what are the symptoms of hyperactivity or impulsivity? You'll find these children fidgeting most of the time. They cannot sit calm in a place. They cannot be calm. They are pacing around. You find them tapping their feet, rocking in a chair, or screaming in a seat. Usually they leave their seat in a classroom in a situation where they're expected to actually remain seated. So it's very difficult for them to remain seated in a situation. You'll find a child running about and climbing excessively, especially in a place where this behavior is inappropriate. Maybe you're in church, everyone else is listening to the sermon, the child is moving up and down. They tend to also have problems in playing or engaging in leisure activity, especially with their fellow children. They talk quite a lot, they excessively talk. You find these children, they blurt out answers before their turn comes. For example, a teacher is in class and is asking a question. Normally, all the children usually put up their hands and they are picked. But you find this child will not wait for their turn and they'll just blurt out the answer even before the question is actually completed. They have a difficulty in waiting in line. If these children are, for example, waiting in line to have lunch or dinner at school, they have a problem with that. And all these disturbances cause a clinically significant distress and impairment in their social functioning, academic functioning, or occupational functioning. What is the cause of ADHD? Basically, it's not clear, but certain chemicals in the brain known as psychostimulants that facilitate the release of another neurotransmitter called dopamine have been implicated. So have the structure and functional alterations in the brain. But genetics do play a big part in that it is passed over generations. It's also important that in utero exposure to toxic substances with pregnant mothers, when they're exposed to toxic substances, they tend to be at risk. How do we investigate attention deficit hyperactivity disorder, or called ADHD? There's no laboratory-based medical test available. So to make a diagnosis, we take the history. We are not going to remove blood and say we have found this and that to make a diagnosis. But how do we manage? The first important step is psychoeducation. We need to educate the family, the teachers about this disorder. Another important part is what we call behavior parent training or parental management training. Here we are teaching the parents how to deal with the children. We want to teach them better ways to deal with the children, to allow them take their time and deal with them. Another thing is behavior classroom training. We want to teach these children how to act in a classroom setup, how to be patient and wait for their turn, how to react to situations in classrooms. Of course, it's also important to teach them social skills that comes in. How do you behave in a social situation? Remember, we said these children never wait for their turn. When they're in church or in a place they are expected to be calm, they are moving up and down. So we teach them how to behave in such situations. Medical care also comes in, where we give them some medication and we use stimulants that are given to them. In the next episode, we shall talk about childhood behavioral mental disorders. Thank you for watching and prioritizing your mental health.